if you believe you can do anything. In this video, I will cover gestational diabetes. That is diabetes that's diagnosed during pregnancy. If the patient already has diabetes before pregnancy, that's called pre-gestational diabetes and will be covered in a separate video. Patients are routinely screened for diabetes during pregnancy between 24 and 28 weeks by using the 1-hour glucose test. This is done by giving the patient a drink that contains 50 grams of sugar and then testing the glucose level after an hour. If the patient has a blood glucose level of 135 milligrams per deciliter, then we go to the 3-hour test. Notice that this level may be different from one hospital to another. The 3-hour test involves measuring the fasting blood glucose level. Then the patient is given a drink that contains 100 grams of sugar. The glucose level is measured after 1, 2, and 3 hours. If the level is higher than expected on 2 out of 4 of those tests, then the patient is diagnosed with gestational diabetes. If the patient has risk factors for developing diabetes, then those tests should be performed early in pregnancy. That's to say, at the first prenatal visit. Those risk factors are high BMI, physical inactivity, previous macrosomic baby, history of gestational diabetes or first-degree relative with diabetes, chronic hypertension, polycystic ovarian syndrome, cardiac disease, and hyperlipidemia. The risk of gestational diabetes can be divided into maternal, which includes preeclampsia and later development of diabetes mellitus type 2, and fetal, which includes microsomia with all its complications, like failed induction leading to cesarean section, shoulder dystocia, hyperbilirubinemia, hypoglycemia, and stillbirth. Management of gestational diabetes begins with lifestyle modification, like healthy eating and gentle exercise, along with monitoring blood glucose for 1 to 2 weeks. The target for fasting is less than 95, and the target for 1 hour after meals is 140, and for 2 hours after meals is 120. If the blood glucose is not well controlled with those measures, medications will be necessary, like insulin, metformin, and glyburide. Insulin is always preferred because it does not cross the placenta. The usual dose is 0.7 to 1 unit per kilogram. Oral medications are given if the patient declines insulin, or if they are unable to safely administer it or can't afford it. If the diabetes is poorly controlled or the patient is on medications, fetal surveillance, which includes an ultrasound scan for serial growth and amniotic fluid index, and non-stress tests should start at 32 weeks or earlier as indicated. Delivery depends on the glycemic control. If the glucose level is well controlled, then delivery at 39 weeks is recommended. Otherwise, patients should be individualized and a maternal fetal medicine specialist needs to be involved in the management. If you want to support this channel, please like and subscribe. Click on the bell to be notified when a similar video is posted. Feel free to share and see you next time.